And in terms of talking about the mortality risk associated with fractures, there was a research study that came out in January of 2024, of just this year that we're in, that looked at vertebral fractures that were identified on CAT scans of patients who came to the hospital for other issues. So they maybe had stomach pain or something like that, and they were getting a CAT scan. And the radiologist who was looking at the abdominal problem also noticed vertebral fractures on that CAT scan. So the medical language for that is opportunistically identified vertebral fractures. And the mortality risk for those patients was increased by 50%. So the patients that came in had higher risk, double the rate of risk of death. And when they did corrections, so they corrected that statistically for gender and age, it was a 300% likelihood of early death associated with that. So the point there is that a lot of times people are walking around not knowing that they have these fractures, although there are signs. As Dr. Elder mentioned, they've lost an inch of height. It's probably a vertebral fracture, right? Could very well likely be. So if you have those fractures going on in your body and you don't know about them, it can result in a higher likelihood of dying. And so that's why we are talking so much about identify your bone health. Know what your bone health is. Know your bones and get treatment if you need it. Learn how to prevent fractures from happening.